pretty color. They match your hair.
Say thank you.
Dr. SACHIN NAGRANI is the medical director for HEAL, a primary healthcare service offering home doctor visits. Since the COVID-19 crisis began, HEAL's home visits have dropped by more than half. But telemedicine appointments have more than tripled and continue to rise.
We wanted to call because Skylar is still not feeling well in her tummy.
The existence of COVID forcing people to not want to go to clinics and reducing that social interaction has really sort of accelerated the pace of adoption of these technologies. And companies that were sort of doing telemedicine before have really exploded.
Upon downloading their app, HEAL used to require new users to have an in-person visit first, but it's now switched to requiring a telemedicine appointment first before visiting someone's home. Telemedicine allows HEAL to safely treat an increasing number of patients dealing with COVID-19.
There are tests that are now available that can be mailed to the home and FedExed overnight back, so they can be actually tested and confirmed positive or negative. And then lastly, sort of managing the symptoms.
The people that are the most exposed with in-person visits are the people that are visiting a lot of sick people. So the more you can keep the doctor away from the people, it sounds kind of funny because like saying, well, I want to keep the mechanic away from the car. But in this particular case, the car can get the mechanic sick.
The nonprofit group Fair Health has set up a tracker for telehealth in the United States. It found that insurance telehealth claim lines increased by 4,347%. That's going from 1.7% of all medical claims to 7.5%.
I think that telemedicine is here to stay. Pre-COVID, without having to deal with traffic or taking time away from work or sitting in a waiting room where there are sick people who might give you something. And now post-COVID, it creates all those benefits, plus the benefit on a wider scale of reducing that transmissibility of COVID around.
Yes, no, it's been sniffling.
Market research company Frost & Sullivan forecasts telemedicine to grow by 7 times by 2025. Mark New, CGTN, San Francisco.